We know Eribulin is very active in HER2 negative metastatic breast cancer. It actually has a survival advantage in heavily retreated metastatic breast cancer. And so the idea is now to try to move Eribulin up to earlier lines of therapy and combine it with Trastuzumab. And so this is a phase 2 trial of about, I think, 50 to 60 patients, something on that order. Half had prior Trastuzumab, half did not, were de novo disease. And in this trial, the response rate was very high, regardless of whether they had prior Trastuzumab or not. It was in the 70 to 80% range. So I think this is going to be a very active choice for HER2 positive metastatic breast cancer. I think the problem with this is that it really wasn't done with Pertuzumab, and so really most of the first line agents now that we use for metastatic breast cancer that's HER2 positive involve both Trastuzumab and Pertuzumab, so that's kind of an issue. The second issue is that it's really not compared to TDM1, which I think is going to rapidly become probably a standard, if not the standard of care, once the Marianne trial comes out in a couple months, hopefully. So I'm not sure. I mean, I think that clearly there's a lot of activity in the first line. I suspect there'll be activity in the second, third, and fourth line, and so therefore I think it's become another potential option, another partner with anti-HER2 new therapy.